Something happens in the hours between midnight and 6 in the morning that most people never think about. Their body is still, their mind is quiet, and yet approximately 30% of all strokes occur in precisely this window, not during the stress of the day, not during exertion, but during sleep. What you do before you close your eyes tonight and the position your body settles into for the next 7 or 8 hours is not a neutral event. It shapes the environment in which your heart and brain either recover or are quietly strained. And for people over 60, understanding this is no longer optional. I am Dr. Naira Stein. Today, I want to walk you through 5 common sleep habits that the cardiovascular and neurological research identifies as problematic, some more urgently than others, and then describe 2 sleep positions that are genuinely protective, with the specific evidence behind each. I also want to share several environmental and monitoring considerations that most medical appointments never reach. Not because your doctor is inattentive, but because sleep position does not fit on a standard clinical checklist. There is no blood test for it, no imaging study, no prescription to write, and so most people never hear any of it. Let us begin with something that sounds benign: sleeping completely flat on your back, with no elevation of any kind. This position feels natural to many people. The spine is straight, it feels like neutral rest. But here is what the body is actually doing when you lie fully horizontal, especially in the post-60 years when blood vessel walls have lost some of their youthful elasticity. When you are completely flat, gravity is no longer assisting the return of blood from the head back toward the heart. Blood pressure inside the skull, what physicians call intracranial pressure, can rise over hours as fluid accumulates in cranial vessels without adequate drainage. Research published in the Journal of Clinical Sleep Medicine found that even a modest elevation of the head, just 15 degrees, significantly reduces this intracranial pressure and improves the return of blood to the heart. That pounding headache you may have experienced at 3 in the morning is not random. It is intracranial pressure building in response to hours of flat positioning. The dizziness that hits when you sit up too quickly is not simply age. It is a warning that the blood flow dynamics during your sleep are not optimal. For most people, the fix is straightforward, and I will describe it in detail shortly. The second habit worth understanding involves sleeping on the right side, particularly for anyone with a history of heart disease, high blood pressure, or any degree of cardiac compromise. This one surprises people. It surprised me too the first time I encountered the anatomy behind it clearly. The heart sits slightly left of center in the chest. When you lie on your right side, the weight of your body shifts in a way that compresses the inferior vena cava, one of the largest veins in the body, responsible for returning blood from the entire lower half of the body back to the right side of the heart. Even modest compression means the heart has to work harder to draw that blood back in. In a younger person with a well-functioning cardiovascular system, this added workload is compensated without consequence. In an older adult whose heart is already managing elevated blood pressure, reduced vessel flexibility, or borderline cardiac output, this additional nightly demand accumulates across weeks, months, and years in ways that do not show up on a daytime blood pressure reading. They show up as a cardiovascular event in the early hours of the morning. The European Journal of Heart Failure has documented that patients with heart failure instinctively avoid the right side during sleep. The discomfort drives them away from it. That discomfort is physiologically meaningful. For those without diagnosed heart failure but with elevated cardiovascular risk, the subtle daily signal may never arrive. The strain continues quietly. The third problematic habit relates to pillow use, specifically stacking 2, 3, or 4 pillows under the head to elevate it. People do this for entirely understandable reasons: to ease breathing, manage acid reflux, or reduce sinus congestion. Some elevation of the upper body is genuinely helpful, as we will discuss. The problem with stacked pillows is not elevation itself, but what they do to the position of the neck. When multiple pillows push the head significantly forward, the cervical spine bends into a position of sustained forward flexion. Running alongside the cervical vertebrae on both sides are the vertebral arteries, blood vessels that supply the brainstem, the cerebellum, and the regions of the brain governing balance, coordination, and the regulation of consciousness. Research published in the Journal of Manipulative and Physiological Therapeutics examined how neck position affects vertebral artery blood flow and found that extreme forward flexion measurably reduces flow through these vessels. Sustained over 7 or 8 hours of sleep, The cumulative reduction in oxygen delivery to these vital brain regions is not trivial. The stiff neck and the dull ache at the base of the skull that many people wake with are commonly attributed to stress or age. In many cases, they reflect restricted circulation produced by a simple and correctable pillow arrangement. One properly contoured pillow, ideally a cervical memory foam pillow that supports the natural curve of the neck without forcing the head forward, changes this immediately. The adjustment is minor. The effect on morning symptoms is often immediate. The fourth position worth discussing is one of the most common sleep postures, particularly among older adults. The tightly curled fetal position, knees drawn toward the chest, chin tucked downward, the whole body contracted into itself. It feels instinctively safe and protective. From a cardiovascular and respiratory standpoint, it creates two problems that work against recovery during sleep. The first is mechanical compression of the rib cage. When the body is tightly curled, the chest cannot fully expand. Every breath taken in this position is shallower than it would otherwise be. Research in respiratory physiology and neurobiology showed that positions involving significant spinal flexion reduce tidal volume, the amount of air taken in with each breath, across the course of a night. For someone with cardiovascular conditions or early respiratory compromise, the cumulative oxygen reduction from hundreds of shallow breaths overnight stresses both the heart and brain in ways that may manifest as morning fogginess, mild headache, or a dull heaviness that is difficult to attribute to anything specific. The second problem is sustained tension in the muscles of the neck and upper back, which compresses the small blood vessels running along the cervical spine and restricts flow to the base of the brain. The practical solution does not require anything elaborate. A pillow between the knees and gentle attention to keeping the body less tightly contracted makes a meaningful difference to both chest expansion and cervical circulation. The fifth habit, and the one I consider most consequential for nighttime cardiovascular health, is going to bed within 2 hours of a large meal or within 4 to 5 hours of drinking alcohol. This one is the most common and the most underestimated of all 5. When a large meal is eaten close to bedtime, the body redirects a significant portion of blood flow toward the digestive system to support the metabolic work of processing food. In younger adults with healthy, flexible blood vessels, the cardiovascular system compensates for this redistribution without difficulty. In older adults with any degree of arterial stiffness or plaque accumulation, this redistribution reduces blood availability to the brain and heart during the early hours of sleep, contributing to lightheadedness and increasing the risk of events in people with already compromised circulation. Alcohol adds a second and separate mechanism. It dilates blood vessels rapidly, causing blood pressure to drop. In a healthy younger person, this produces relaxation. In an older adult with stiffened arteries, the compensatory response to this drop, the body's attempt to bring pressure back up, produces the opposite, a pressure spike. This cycle of drop and spike, repeated over the hours that alcohol remains active in the body, places mechanical stress on vessel walls that are already less resilient than they were in younger years. The American Journal of Hypertension studied the relationship between alcohol consumption close to bedtime and the body's normal nocturnal blood pressure pattern. Healthy cardiovascular function involves a natural blood pressure dip during sleep. Alcohol consumed in the evening disrupts this dip, keeping nighttime pressure elevated and increasing the workload on the heart and vessels through the hours when they should be recovering. The practical adjustment is direct. Finish the main evening meal at least 3 hours before going to bed, and if you drink alcohol, allow 4 to 5 hours before sleep. A 15-minute walk after dinner accelerates the initial phase of digestion and significantly improves the glucose and blood pressure response in the hours that follow. This single change, timing and a short walk, has more impact on overnight cardiovascular risk than most people imagine. Now let me describe what the research does support. 2 sleep positions associated with genuinely better cardiovascular and neurological outcomes during sleep. Left side sleeping is the position that cardiologists and neurologists most consistently recommend for older adults managing cardiovascular risk. The anatomy explains why. With the heart sitting slightly left of center in the chest, lying on the left side allows gravity to assist rather than oppose blood flow. The inferior vena cava, which runs slightly to the right of the spine, is not compressed. Blood returns to the heart with less mechanical resistance. The heart does less work across the night. This is the basic cardiological case, and it has been documented in the European Journal of Heart Failure Research referenced earlier. But there is a second and more recently understood reason why left-side sleeping matters for long-term brain health, one that has emerged from research over the past decade and that most people have never heard. Scientists have identified what is called the glymphatic system, a network of fluid channels that operates primarily during sleep and functions as the brain's waste clearance system. During sleep, cerebrospinal fluid is actively pumped through the spaces surrounding the brain's cells, carrying away metabolic waste products, including the amyloid beta and tau proteins that accumulate in the brains of people who develop Alzheimer's disease. A study published in the Journal of Neuroscience found that glymphatic clearance is significantly more efficient when the body is lying on its side, and evidence suggests left-side positioning optimizes this flow. What this means is that left-side sleeping is not simply about cardiovascular protection tonight. It is about whether the brain's own cleaning system is running efficiently every night for the next 20 years. Amyloid and tau proteins that are not cleared accumulate gradually. By the time symptoms of cognitive decline appear, the accumulation has been building for years. Sleep position is one of the variables that governs whether that clearance happens effectively or imperfectly. For those who find left-side sleeping uncomfortable due to shoulder pain or joint issues, the adjustment does not have to be absolute. A body pillow positioned in front of you maintains the body in left-side orientation while reducing pressure on the shoulder. A small pillow between the knees takes the rotational strain off the hips and lower back. And perfection is not the goal. Spending more of the night in the left side position than in problematic positions is what matters. Even a partial shift produces benefit. The second protective option is back sleeping with gentle, sustained elevation of the upper body, not just the head, but the entire upper torso, at an incline of 15 to 30 degrees. A wedge pillow or an adjustable bed frame achieves this most reliably. Standard pillows stacked under the head produce the forward neck flexion problem described earlier. The elevation must include the upper body, not just the head, to be effective. This position addresses three separate mechanisms simultaneously. First, it facilitates the return of venous blood from the lower body to the heart, reducing the cardiovascular workload overnight and improving circulation in people with varicose veins, swollen ankles, or any degree of peripheral venous insufficiency. Second, it reduces intracranial pressure, the same mechanism that flatback sleeping worsens, by allowing gravity to assist fluid drainage away from the cranial vault. For people with fragile cerebral vessels or uncontrolled blood pressure, this reduction in intracranial pressure matters considerably. Third, it keeps the airway more open. For those with mild sleep-disordered breathing, mild snoring, or sinus congestion, this elevation meaningfully improves oxygen delivery to the brain throughout the night. Adding a small pillow beneath the knees when using this elevated back position completes what NASA's research on astronaut positioning identified as a zero-gravity posture, a body alignment that distributes pressure evenly and minimizes strain on joints, the spine, and the blood vessels supplying the lower body. It is important to note that this position is not universally appropriate. For people with severe sleep apnea, back sleeping even with elevation may not adequately maintain airway patency, and left-side sleeping remains preferable. For those with significant shoulder arthritis, the elevated back position may provide relief that side sleeping cannot. The goal is to understand the reasoning well enough to apply it to your own specific circumstances. Beyond sleep position, the environment in which you sleep directly influences how effectively the cardiovascular and neurological recovery of sleep actually occurs. Temperature is the most frequently overlooked variable. A bedroom temperature between 64 and 68 degrees Fahrenheit allows the core body temperature to drop, which is one of the primary triggers for entering the deep sleep stages where the most significant cardiovascular recovery and glymphatic clearance occur. A room that is too warm keeps the body in lighter sleep, keeps the heart rate elevated, and prevents the physiological conditions under which genuine repair takes place. Eliminating light-emitting screens, phones, tablets, televisions, after 9 in the evening protects melatonin production, which governs the timing of deep sleep onset. Without adequate melatonin, the transition into the deeper stages of sleep is delayed, and the window during which the brain carries out its clearance function is shortened. Consistent ambient sound, a white noise machine or simple earplugs, prevents the repeated microarousals caused by irregular noise that jolt the nervous system out of deep sleep without fully waking the person. These microarousals produce cortisol spikes and brief heart rate elevations that the person does not remember in the morning, but that their vascular system registers cumulatively over months. For those who want to move beyond awareness into active monitoring, there are 3 tools that offer genuinely useful information without requiring any clinical intervention. An overnight pulse oximeter, a small device that clips to the fingertip, tracks blood oxygen saturation continuously during sleep. Oxygen that repeatedly drops below 92% is a meaningful signal requiring medical attention. It may indicate sleep apnea, poor circulation, or respiratory compromise, all of which independently increase stroke risk. This data, brought to a doctor's appointment, is far more informative than a description of morning symptoms. Heart rate variability, measurable by a range of consumer wearable devices, reflects the responsiveness of the autonomic nervous system and is an established early indicator of cardiovascular stress, systemic inflammation, and metabolic dysfunction. Low heart rate variability during sleep indicates that the body is under physiological strain during the hours it should be recovering, and a simple morning symptom journal, recording headaches, dizziness, numbness, tingling, or cognitive fogginess on waking, creates a pattern over time that is far more informative to a clinician than a single office visit description of symptoms that may have already faded. These are tools for awareness and data gathering, not substitutes for professional evaluation. But they transform a person from someone describing vague symptoms to someone arriving at a medical conversation with objective, trackable information. I want to be direct about why most people have never had this conversation with their doctor. Sleep position and the bedroom environment simply do not fit into a 15-minute appointment organized around blood tests, medication adjustments, and acute concerns. This is not a failure of care. It is a structural limitation of the standard clinical encounter. What the research is increasingly showing is that the nightly habits that occur outside of clinical view have a genuine and cumulative influence on brain vessel health, cardiac workload, and cognitive trajectory over years and decades. These are not hypothetical or speculative connections. They are documented mechanisms: intracranial pressure dynamics, glymphatic clearance efficiency, cardiac preload during sleep, the nocturnal blood pressure dip, and what disrupts it. For an older adult managing blood pressure, with any personal or family history of stroke, or with the kind of morning symptoms that are easy to attribute to aging, morning headaches, brief dizziness, unexplained fatigue on waking, these variables are worth understanding clearly and specifically, not with alarm, but with the kind of informed attention that makes daily choices more deliberate. One change is the right place to start. If you currently sleep on your right side, try shifting to your left, using a body pillow in front of you if needed. If you sleep completely flat, try a gentle upper body elevation of 15 degrees. If your last meal or your last drink is too close to sleep, begin moving those habits earlier in the evening by 30 minutes, and then build from there. One change, given 7 days, measured by how you feel on waking. Your body will tell you whether it is working. I am Dr. Naira Stein. The hours your body spends in sleep are not passive time. They are the most active repair and recovery period your heart and brain have in any 24-hour cycle. How you position yourself, what you have eaten and drunk in the hours before, the temperature and the light and the sound in the room where you rest, these are variables within your control. Use that control deliberately, and your cardiovascular system and the brain you are protecting for the decades ahead will benefit from it. Take good care of yourself. I will see you in the next one.